Assalamu alaikum. Welcome everyone on board. Um, Today, um, we will be discussing something different. If I ask any one of you that how you study, like how if you want to study any topic, what's your way of studying? Anyone, please. Tayyab?
Yes, sir.
Yes. How you study?
Sir, fairly, I want to tell you, mostly I do exam-oriented studies.
Okay. What do you mean by exam-oriented study?
For example, if the exam is MCQs based, then I assess what is the pattern of exam,
Hmm.
from which book this exam mostly comes, and also I try to approach previous exams MCQs pools and
Okay.
try to revise them many times and then do it.
Okay, so you are not interested in studying topic oriented.
Sir, this becomes sometimes difficult, and I think in order to pass an exam, we have to do what exam asks us or requires from us. Studying topic oriented is something different for our knowledge, but
Hmm.
to pass exam, we have to use these tactics.
Okay, but my advice and my what I suggest to everyone is that you study topic in a way that you know all the aspects. Then any exam, whatever exam you are appearing in, you don't need to look at what sort of exam it is. Okay, and what sort of whether it is oral, whether it is MCQs, whether it is written, it doesn't matter actually. Okay, so this is my point of view. Any other? Is this Dr. Hasham from Qatar? Hasham Ahmed from Qatar? Yes, Dr. Kamal, you wrote that by books targeting MCQ. What do you mean by that? Please speak out. Actually, we are not discussing any topic at the moment. I just wanted to have few words about
Hello,
how to
Assalamu
study.
alaikum.
Walaikum assalam. Yes,
Yes,
Dr. Kamal,
sir.
what do you mean
Uh,
by books targeting MCQ? What do you mean by this statement?
Sir, exactly the same. The books which we are following, textbooks, and keeping side by side the MCQs book, like
Okay, which is
Cyprian
what do
and
you
this.
mean by textbook? What is, I just want to clarify myself. What is the concept of textbook? What do you mean by
Are the
textbook?
same Morgan and Atkin had.
Okay, Morgan is textbook. That's my simple question.
Sir, during our yes, sir, during our
Forget about it.
training, yes, during
Forget.
our training, that's this.
No. I'm sorry. You are mashallah doctor. You are doing post graduation. Okay, so you should think yourself. What is meant by textbook? Because textbook means it has written everything. Textbook means like it is covering all the aspects. So you name any, like this is again, because today actually I was very tired, so I didn't prepare, or I don't want to discuss any specific topic. So my aim was just to think out that what do you like, what we mean when we are saying that, like we are, because this is a big confusion which is there in everyone's mind. Okay, so please just let me know. Yes, please. Maybe some problem. Yes, Dr. Kaval.
Yes, sir.
Yes, I'm sorry, I muted you. Just unmute yourself and tell me.
Yes, sir. Sir, actually, the same problem. Still, we are not, for me, yani, I am not still oriented to read the topic wise by the articles. I found it difficult to grab sound knowledge by this
Okay.
article. So that's why still I am opening this Morgan.
No, but that's what my simple question. That how, like, for example, you name anything, you name any topic. That what you read from Morgan, and you can just ask you that how, uh, how you can trust that book. That's my simple question. Or anyone, please, anyone else who wants,
Sir,
because
like
yes.
means as if I started cardiovascular system, I open the CVS from page to page. I am going to read it
No, but actually the thing is that that's what
again and
actually
again. But
that
it's
is
still
my
the
what is
same.
my that is what my message is. Okay, that unfortunately this is totally wrong approach, because what happens that at the end of the day you are in no man's land. Okay, because like, unfortunately, you are not able to grab any topic in that way. Okay, I don't know what is this problem, because there is this way was valid for other subjects, like when we used to study physiology, pharmacology. There are enough books which can be called as textbook. Okay, but these days, okay, when we are in era of like critical thinking and critical understanding, unfortunately this is failed way. Because if it is like valid, I'm just trying to find, because it was, I don't know what happened, I was not able to open it. So let's open this holy book of anesthesia. Okay, you were talking about cardiovascular system. Yes, doctor.
Yes, sir.
Okay, so you were talking about cardiovascular system. Okay, so you want to, first of all, if we just think about cardiovascular system, what you should know about cardiovascular system?
Sir, basic physiology.
Basic physiology. Okay, so do you think you will be able, this is because this is chapter, uh, what chapter is open now? This is something else, I think. Uh, just a second, please. Okay, so what do you think, this knowledge is reproducible? Like, if you read this chapter, will you be able to understand? The forum is open for
No,
everyone.
sir. But
It's not
again and
for only
again,
Dr.
yes, sir.
Dr.
But
Kamal. I would like to listen from all of you. Okay, because I want to solve this problem. Dr. Abid, you are working in a car in a cardiac center, am I right? Like, Dr. Kamal, just if I ask you this question, because I'm not 100% sure what is the aim of like, what is the real objective. This question I was wanted to prepare for this topic. Like, there was a question which was asked in EDA, heart lung relationship. I couldn't get the further details of the topic which was being asked. What do you mean by heart lung relationship?
Sir, don't know exactly.
Okay, so anyone who can defend studying from Morgan. I want to understand, because when I have studied Morgan, because when I used to study Morgan, I don't know anything. I was not able to speak out even in front of myself. Okay, that's what I want to you to understand. That, for example, if you want to understand any topic, you should be knowing what are the targets, what are the like for example, just tell me, if you want to understand Dr. Kamal, simple inotropes. Okay, can you cover them in from Morgan?
Yes, sir.
How will you cover them from Morgan? Inotropes, vasopressors.
Sir, for that
Because
reason, I have to open the pharmacology book or this
okay,
ICU book or the searching from
okay. So you surrendered.
this
You
EMA from
surrendered that
I am
the the
searching
the
all
the
medicine from
so-called
EMA.
the so-called textbook is failed. Am I right?
Yes, sir. Yes,
Don't be
sir.
afraid. Don't be afraid. Don't be afraid. But I please, if anyone has some words to say, speak out, please. I will be very happy, because I want to liberate you people from a single book worship. Okay, because till the time, like for example, if you want to understand CVS, okay, you should be knowing the basic physiology. Yes, okay, but there are one mechanical functions of heart. Okay, there is one electrical system or conductive system of heart. Okay, then relationship between heart and lungs, this is the basis of even then the filling pressures. Okay, and then relation, we can expand this with the vasculature, like how the blood pressure is being controlled. Are you getting it? So you need to understand these things. Like for example, if we
Yes,
talk about blood pressure, how the blood pressure is being regulated. There is one short time or quick control. Then there is intermediate, and then long term, like through starting from baroreceptors to renin, angiotensin, aldosterone system. Okay, and then like modulation. So similarly, if you want to understand the inotropes and vasopressor, first of all, you should be knowing the autonomic nervous system in form of, for example, sympathetic system. What is the effect of alpha 1? What is the effect of alpha 2? What is the effect of beta 1? What effect of beta 2? What is the involvement of dopamine receptors? And thereon. So my message is that till the time you don't understand, or you don't know your enemy, how will you attack it? Are you understanding my point? Then very important, this, like, I'm just giving you an idea. We cannot cover whole cardiovascular system, but I'm just telling you that there will be some assessment. I have actually discussed in detail in that way, that what are cardiac signs and symptoms. You should be, if you want to understand cardiovascular system, you should be starting from these things. Only then you can understand, like for example, if you understand that if you want to pick out any problem, you should be knowing, of course, the normal physiology, but what happens when the physiology is being changed. And then the most symptom which you will see will be either chest pain or dyspnea. Okay, and then you will quantify the dyspnea, chest pain and dyspnea, whether it is orthopnea or PND. Okay, And then you will evaluate with, like, I'm just giving you an idea. Then you will be doing some investigation.
Sir, hypotension, arrhythmia.
Yes, like I'm giving you an example. Like you will not find these things in one book. So till the time you don't understand the concept, that is the problem. Because as Tayyab mentioned, that the exam which I want to pass, I will try to cover in that way. That's why people fail. That's why people fail. That's why you are not passed. You understand my point? Because unfortunately, you are not coming out of this myth, because you started with the discussion that Morgan is a textbook. You start your quotation from that thing. If I ask from you or anyone, please, no one else is speaking out. So the discussion will not be that much fruitful if you don't, like, for example, if you don't know what information you are getting from echo or ECG, echo or ECG or chest X-ray, for example, you cannot understand the whole picture. And in the exam, the question will not come from specific book, mind it. Zishan, I would like you to speak out something, because you have passed the exam, and now you can have a critical analysis about these things. Because Dr. Kawal was stating that Morgan is a textbook. So I just wanted to understand that how Morgan is a textbook.
Yes, Assalamualaikum, sir. I just joined and I just listened to this comment, of course, of textbook. Morgan is a textbook. Etkinhead is also a textbook. Miller is also a textbook. Oxford is also a textbook. Then why not go for all of these? If we have to follow a textbook, then every book is a textbook.
You know,
So you
Doctor,
can't do all the books, but you have to
yes,
select topics from each book.
which can help you out, which can rescue.
Yes.
Okay,
So you
actually,
have to
just
select topics that
yes,
if you are, yes, which gives you all the points.
yes. First of all, again, I am saying the same thing, that you
And
should be
the
knowing your.
compilation that I made of my notes, it was of.
Yes, yes. So actually, I
Yeah,
don't
sir.
know. There is some problem in my connection, and the
हाँ,
Google Drive is not opening. But I just, you people know about the link which I have compiled. But I'm just telling you an example that if you want to understand or you want to learn any topic, first of all, you need to know what are the pearls of that topic. Okay. Only then the next step will come after that. Till the time you don't know what are the pearls of any specific topic, you cannot move forward. Okay. uh, I wish, uh, I don't know what is the issue. It's not opening. Just a second, please. There's some issue. um so my suggestion is that please try to understand this point. Don't follow anyone without a logic. Okay, just try to find logic in everything, and then you will see that life is totally different from what you people think. Like, this is another textbook. You did not name this book. This is also a textbook, textbook of problem oriented. Okay. And unfortunately, like, it is people are reading it, and it's not reproducible. Just some people open this book, Oxford. Okay, yes, it is better. At least it is much better than Morgan, because whatever it is writing, it has some sense. So if you ask me, yes, it is much better than Morgan, because Morgan has no sense, unfortunately, believe me. So I ask the people who read Morgan, what are you understanding? What are Because at the end of the day, the only thing which is important is that what you can reproduce. If you cannot reproduce anything, just tell me what's the advantage. So with reference to the articles which I say, because I will need to, unfortunately it's not opening. So, like, if for example, if you just think about cardiac, so you try to read it from here. Believe me, you will find it much better than what you are reading, and for what you are reading at the moment. Okay, these are articles for it. And like, of course, you need to understand the physiology, you need to understand the anatomy, you need to understand the relationship. Okay, like can anyone have you people read about lactate? Any one of you? Because
Not
usually,
separately.
yes, actually, I just want to highlight this thing that usually lactate is, people think that it is only related to hypoperfusion. Okay, and it is, because lactate, you will be thinking about ischemia, you will be thinking about lactate levels in sepsis, you will be thinking about any anaerobic metabolism going on. You should be thinking about any source of ischemia, like one of the biggest source of increase in lactate usually it will be in gut ischemia, for example. Okay, but there is another condition which is because of enzymatic defect, which is leading to the metabolism of the lactate. Okay, so the type A is what we usually deal with. So it is in which tissue hypoxia results in faster production than removal, and type B, in which over tissue hypoxia does not play a role. Okay, so it is related to the enzymatic problem. I'm just giving you an example, and I'm 100%, even I have not read it in detail, but I just came across when I was preparing for like when during my training, I never read these articles because these articles were not there at that time. And I was just rubbing my head and my whole body and even my whole family to this bloody manhus Morgan, and I was not understanding anything, and I was just thinking, I was puzzled, what's the issue? Because when they ask the question, I'm blank. I'm just thinking, what's going on? I don't understand anything. I don't know anything. I have just rubbed myself to this book, even problem oriented, even, and I don't know anything. Then I came to know that the problem, the torture which I suffered, was because this source which I was reading was absolutely crap. And then I rediscover myself. Okay, so if you, yes, it will be difficult to swallow, because if 99 people around you are saying read Morgan and Mikhail, it's very difficult to understand. Okay, so I'm just giving you like food for thought, that how you should be targeting. Okay, so similarly, like of course, you see that there are so many articles. Oh, sir, we have to read each and every topic. No, it's not like that. You just have to read one topic, one article related to that, and you can just compare it with the others. Okay, like fetal circulation. I'm just giving you an example. Fetal circulation, if you don't understand fetal circulation, it is very difficult for you to understand congenital heart diseases. Cyanotic versus acyanotic. What is the physiology of cough? What is the physiology of Eisenmenger syndrome? What is the physiology, like what is the problems related to right to left shunt, left to right shunt? So if you don't understand this thing in detail, you will not be able to progress. Yes, it is written in Morgan, but how many people of you are understanding it? Like they will be asking you about oxygen hemoglobin dissociation curve in different types of hypoxia. Will you be able to understand? I never understood when I used to read from Morgan. So my suggestion is that I'm there to help you out, and there will be many people, and even you, if you will use your brain a little bit, you will come to know this thing. Okay, so try to whenever, like, my request or the purpose of this session is that whenever you are trying to read any topic, try to first of all understand what are the important things or what are the things to do from that topic. Make a notes like that. Then start, rather than reading any book blindly, try to read it, finding the answers. And I can guarantee you that whatever we are studying in anesthesia, believe me, there is nothing which I have never studied before. We all have studied cardiac cycle. We all have studied fetal circulation. We all have studied each and everything which we study in anesthesia, except for physics, surgical diathermy and defibrillator, and these are the things, maybe pressure and these. But other than that, we have studied everything in our medical college, and we just have to correlate correlate with each other. So till the time you don't understand what are the pearls, what are the important things which you should be knowing about a specific topic. Like Dr. Kamal, sorry to ask, because no one else is ready to answer except Zishan is an exception. So Zishan has already passed. So nobody else is interested in answering. So I will ask you again this question that just it come to my mind. TURP. Okay. If you want to understand TURP, for example, TURP syndrome. Okay. So you should be starting from, from where? You should be knowing about elderly physiology, because usually TURP operation will not be occurring in any pediatric patient. Okay. So it is exclusively of problem of elderly patient. Then this surgery will be doing in lithotomy position. So you should be knowing about lithotomy problems and things related to lithotomy. Then you should be knowing about this uh, like problems related to volume overload with specific to sodium balance. Okay. So if you don't understand how sodium balance is maintained, and how it is, what happens in hyponatremia, and how it is need to be corrected, and how much it needs to be corrected, you will not understand. Then the surgical things will be separately. Like surgical thing will be related to the irrigation fluid. Okay. And different techniques. By the way, now they are doing it in laser, in which they are using normal saline. So that this problem related to that thing is almost finished, because they are using laser and they are using with normal saline. So it's the problem is finished in new techniques. But of course, it takes a lot of time, 3 to 4 hours for the same surgery. Okay. So they have, if the black
Also,
the
also with bipolar also.
bipolar also, yes. But I'm just telling you that if, for example, if you want to understand about TURP, you need to know of everything. Maybe I'm just, because I'm just giving you a hint. Please try to understand like that. You can make your own list. One will be topic disease oriented. Like make a list of the diseases, make a list of the surgical procedures, and then start studying in that way, rather than opening keep a silence, do wuzu, and then start reciting in that way a Morgan from page 1 to the page last page, like on Nauzubillah holy book. And at the end of the day, you don't understand and you don't know anything. Just tell me, what is the advantage? Just you are doing post graduation, and you don't know what you want to understand, what you want to know. So that is the biggest reason for failure. And believe me, that when you will become a consultant and when you will be on the other side, you need to take decisions. And then Tayyab, because Tayyab is my friend, Tayyab is my class fellow, and but I have always have a fight with him that why he's saying me sir, 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 because I don't like to listen sir from him, but still he says. Anyways, I cannot correct him. Like I cannot pull you people out of Morgan. I cannot stop him. So Tayyab, your approach will, because you are very intelligent, you can cover it up, but not everyone. And that is the reason I have seen people struggling in FCPS, not for 1 year, 2 year, 3 years, because I finished my training in 2011 and I passed my exam in 2013. And unfortunately, there are some of my seniors who couldn't pass and who haven't passed up till now. Like I will not name that fellow. He was my senior registrar. He had done MCPS, and when I was doing training, he was, since then he is appearing in FCPS Part 2 exam, and it's been, I think, at least 13 years, and he has not passed the exam. And he's in I think in mid 50s, and he's arrogant, he is egoistic, he always say Morgan, Ustad Morgan. This is his wording, what is written in Stad Morgan. Okay. So unfortunately, I have seen a torture. So this message is not for this is the same picture is for problem oriented. Same picture is for Smith. Same picture is for Oxford. And actually they are, all of them have a lot of knowledge, because anesthesia is the same, whether you are doing oral part, whether you are doing, but unfortunately, because you people are not tuned during your training, during your time. So when you are in the exam, one time you, because there is a concept of appearing, and you say, I'm taking the attempt. The people from Karachi, they use this word, I'm having this attempt. So attempt, they are not saying never, I never lesson from that, I will inshallah pass. They always say, sir, we are taking attempt of March. So attempt of March means you are not ready to pass. So this word, I have argument with this word. Okay, because if you are just attempting without preparation, it's useless. And there is another, I will label, I will tell you, share with you, that once I was contacted by two of friends who were appearing for the MCPS Viva. They were 100% counseled by some people that please you appear in the talks and you only pass talks, so that next time you only have to appear in Viva. And I was contacted by one of them, and after some time another lady called me. So actually both of them were friends, and I twisted the necks for both of them, and I told them that if you want me to guide you about talks, I will not guide you like that. So believe me, I just told them to approach in that way. Alhamdulillah, both of them passed. So actually, unfortunately, you get the wrong information. And if someone tells you the correct information, you don't believe, because it's a rare entity, unfortunately. So my request is that if any junior resident is listening, please change your approach. Your approach should not be in the way that you are cramming the words of any holy book, and after that you don't know anything. So like I will wrap up here. Okay. And I hope I give you some message related to studies, that don't be afraid from these articles. These articles are still, even you don't need to worship each and every line for these articles. You just, for any topic, just try to make a sketch that this is probable questions or probable task which you should be clear, and make points by points, that you should be knowing that this point I need to be clarified, this point need to be clarified, this point need to be clarified, and then it will make a building blocks. And then I can guarantee you that whatever exam you are appearing in, inshallah, that exam will become very easy for you. Okay. So thanks a lot, and inshallah we will have some proper topic inshallah next time. Okay. So bye bye.